We were wearing our masks, but we're going to remove them since we're more than 6 feet apart. I'm Delayne Sigerman. I'm currently on the Kerrville City Council, and I've been conducting various interviews in and around town with businesses and people just to see how they've been faring through the last couple of months. So today, it's my pleasure. I'm here with Katie Givens, and I'm going to let her tell you a little bit about her role here at Doyle Community Center and a little bit about Doyle. So
Sure.
Katie?
Right. Thank you so much for having me. It's an honor and privilege to do this today. So my name is Katie Givens, and I am the Hope for Health Project Manager here at Doyle Community Center. And just a little bit of background, in November of 2019, New Hope Counseling Center was the lead nonprofit to write a national grant application to the Build Health Challenge Award. And the Doyle Community Center was one of 18 in the United States to receive the award. It's a $250,000 award for a period of 2.5 years. And what we wanted to do was start the Hope for Health initiative. We have a team of 6, and we all office here at Doyle. And what we do through the Build Health Challenge Award is we provide free transportation, food, counseling, and healthcare. We have an on-site clinic here. All of them, except for food, are only for Doyle residents. We have partnerships with Peterson Regional Medical Center and the Texas Department of State Health Services. So because of all the misinformation around COVID, we were able to go to them and say, we want to hand out packets about Hope for Health Services, but we also want to give people the right information. What do they do? Where do they go? What are the actual symptoms? And so we were able to do that. We were able to translate them in English and Spanish and hand those out. So it became essentially a coronavirus information station.
That's wonderful.
And then out of that came the food distribution.
And I'm glad to hear about the exposure Doyle had because of it. Even though the COVID time has been difficult for everyone, I think it probably did shine some light on Doyle to the broader community now that they didn't know before.
Right.
So,
and that is one thing. We're not just focused on serving the Doyle district. We are a community center, and we are like Clifton Fife Road. We're alive and kicking over here, and we are. I mean, we've had through all of our community engagement, social media posts that Clifton's been organizing. We've had over 10,000 views.
Wow.
People are coming and saying, I went to kindergarten at Doyle, all these things. And the connection, we've had so many people step up and give donations, just drop off cash,
wonderful.
Checks and foundations that have stepped up. And we have people wanting to partner with us left and right, and so now it's a matter of, can we manage everything? Right. And it'll be in the papers soon. I can officially say this now, but we also received the Healthiest Cities and Counties Award. It's a $100,000 award.
Wow.
We were one of 20 in the U.S.
Doesn't seem to stop y'all.
No, we're just going all in. But that is going to help us establish a food pantry here at Doyle.
Really?
And it won't just be for Doyle residents, but we'll focus on that because we do have a partnership with Light on the Hill.
Right.
They're going to kind of handhold us through the whole process, and because of the renovation starting, we're going to temporarily have the food pantry over at Barnett Chapel.
Okay.
We have a partnership with Glory Community Garden, and part of Build is healthy eating, food, teaching, and cooking classes and things like that. So we're very excited about also launching a food pantry here.
What are some of your needs that maybe you still have a need for something, or you could use some extra help with? Is it volunteers, or just getting the word out about what you just told us? Like, this is one way we can do it. This is a vehicle we can get the word out. But is there anything else that you think the city could do, or just myself or anyone that's watching?
On the volunteer side of it, this has brought a lot of volunteers to us. There have been people, not just locals, but people want to be here. People want to help. We've had families come, bring their kids. Yesterday we had our food. We are doing food distribution still, but only on Wednesdays.
Okay.
And it's from 11 to 2:30 out on the pavilion.
Okay.
You know, we social distance and all of that, but we have Pint and Plow has stepped up. They bring over pizza, salads,
Really?
Reuben sandwiches, and then we have Kerr County Produce that brings over huge things of fresh vegetables and fruit, and then we have Light on the Hill who's providing us with all the non-perishable bags, eggs,
Right.
Sometimes milk and that kind of thing. So on the volunteer side, we actually are like, we need a volunteer coordinator, but we need money to do that, you know, to pay somebody. So I think big picture wise, because I'm a fundraiser and have been in nonprofit, my brain is going, we need more money. We need more money to keep it sustainable.
Right.
So we're looking for more donations, more grant opportunities. We have the local foundations here, Stevens and Peterson, have stepped up. The city has stepped up to give us all the renovation dollars and
Right.
allowed us to hire Clifton, who's our community outreach coordinator. But I guess any connections with foundations would be great. And then beyond that, when the center reopens, we will be looking for more ways to serve the community and getting the word out for, you know, being able to rent space here and utilize the center because it's so beautiful and it'll be so functional afterwards. It'll be a great space. The last thing would be that our goal over the next 2.5 years is to try and touch every resident in Doyle in some form or fashion, whether they get a ride or they see our nurse practitioner or whatever it is. And we're making progress, but we still are trying to brainstorm all the marketing phases. We've done flyers, we're set up at the tent, word of mouth around here, social media, but the more we can get word to the neighborhood, we want them to utilize all the services.
Right.
We've had residents here that drive by and say, oh, we didn't know y'all were doing anything. What's going on?
Right.
You know, we have drop-ins, but anybody essentially can come in and do an intake process with Karen Maddox or Lala Flores. And if you're not a Doyle resident, they will connect you with other resources in the community.
Out of these trying times, what kind of silver lining do you see?
Had it not been for the pandemic, we wouldn't be where we are as far as serving people and having all of the press and people knowing that Doyle is here and alive. And you know, and part of the grant too was the trust factor with the community, because over the years there have been things that have happened, things that have said would be done, and now people see it physically. Not only are they receiving the services, but they see all the cars in the parking lot, and they can walk in and, you know, do an intake process and get help with, you know, whatever it is. I mean, Lala has, our community health worker, she has a background in all of the social services type programs like Social Security, Medicaid, food stamps, and
that's wonderful.
There have been people that have come in that don't even know they're eligible.
Right.
So she walks them through that process.
That's wonderful.
Of, you know, and if it's not somebody that we can help right here, then we refer them out. And we have Teresa Standage, the Wesley nurse that is a part of that. So we are anticipating big things, and we do have an opportunity in April 2022, when this grant period ends, to be re-upped for another $250,000.
Really?
And I believe wholeheartedly that we are in a great position to get that.
That's
not only
wonderful.
because of the impact we've made, but because of our response to COVID, the additional partnerships we're bringing on, and all of the additional funding that has come in. We're at over $175,000 just since February in dollars that have come in, and that's not just for renovation. That would be for Hope for Health.
And thank you for taking the time this morning to be here.
Thank you so much. I really appreciate it.
You're welcome. Okay, that's it.